Hi there. This is Kelly Nash. Welcome to the National Briefing, where we are going to go in the Wayback Machine. I'm going to take you back. This is 16 years ago. Barack Obama, recently elected president, gives what is considered at the time one of the most important speeches of his life. He's talking to the folks who work over the American Medical Association, explaining to them the brilliance of Obamacare and how he really needs to push this forward in order to basically save America.
Today, we are spending over $2 trillion a year on healthcare.
Wow.
Almost 50% more per person than the next most costly nation.
Wow. That is staggering that we were spending almost twice as much as other nations. And it was $2 trillion a year? Goodness gracious. Of course that had to change. And thank God he fixed it, because today we spend on average about $14,000 per person, and that is roughly 58% more than other countries. Wait a minute, what? It got worse? Well, at least the $2 trillion has come down by now, right? No. In 2023, we were spending $4.9 trillion. So it had more than doubled since Obama's major speech. Now, this is a little bit longer of a clip because I've taken the rest of that 50-minute speech that he made, and I've condensed it to 90 seconds.
I am convinced we can bring spending down, bring quality up. We can save hundreds of billions of dollars on healthcare costs while making our healthcare system work better for patients and doctors alike. Each time an uninsured American steps foot into an emergency room, the cost is handed over to every American family as a bill of about $1,000. It's reflected in higher taxes, higher premiums, and higher health care costs. It's a hidden tax that will be cut as we insure all Americans.
Let's cut taxes, yes.
So, when you hear the naysayers claim that I'm trying to bring about government-run health care, know this: they're not telling the truth. What a public option will help do is put affordable health care within reach for millions of Americans. I've set down a rule for my staff, for my team, and I've said this to Congress. Health care reform must be and will be deficit neutral in the next decade. And by making the reforms that will help slow the growth rate of health care costs over the coming decades, we can look forward to faster economic growth, higher living standards, and falling instead of rising budget deficits. I'm here today because I don't want our children and their children to still be speaking of a crisis in American medicine years from now. I don't want them to still be suffering from spiraling costs that we did not stem or sicknesses that we did not cure. I don't want them to be burdened with massive deficits we did not curb.
Wow. Well, you know what? Thank God that Barack and the Democrats had the chutzpah in order to make that happen. Because you know what? We would be in such a much worse place had we not actually gone ahead and taken care of the Affordable Care Act and made health care affordable for all. Now, one person who doesn't agree with that, I guess he doesn't like the health care system, would be Bernie Sanders. Bernie, yesterday on the CBS Morning Show, explaining, now again, the Affordable Care Act was signed in March of 2010. So we've had more than 15 years of fixing it. So it's fixed. You've seen it played out. It's a decade and a half later. And what is Bernie Sanders' assessment?
Right now, as I think everybody knows, our current healthcare system is broken. It's dysfunctional. We spend twice as much per person as the people of any other country, 85 million uninsured. It's a broken system. What Trump did in his big, beautiful bill is to throw 15 million low-income and working-class people off the health care they currently have by massive cuts in Medicaid and the Affordable Care Act. You know what studies show, guys? Let's talk about this. Studies show that when you throw 15 million low-income and working-class people off health care, 50,000 people a year will die unnecessarily. And then on top of that, all over the country, in my state of Vermont, all over the country, people right now are receiving notices from their insurance companies. Their premiums are going to go up by 20%, by double.
So open the government and vote on it. Make the case.
Really? No. And let 50,000 people die if Trump vetoes the legislation. I cannot allow, in good conscience, 50,000 people a year to die unnecessarily.
I wonder where he got that study from, by the way. I mean, did we do a study where we took people off health care in America and let them die? We were losing 50,000 people a year in that study of his. That does sound like something that, Tony Fauci would have done. Because if you're talking about like in Africa or someplace like that, that's completely different. And everybody should know that. But anyway, Bernie Sanders, he's taken the moral high ground that if we don't get, and I think everybody's heard the argument by now, we need that $1.5 trillion extra in order to cover the rising healthcare costs and make sure that illegal aliens don't die. He'll argue against that all day. There is no illegal aliens. It's against the law, okay? Anyway, Bernie's also one of the people who would say, breaking into America is not illegal. It is not a criminal act. It's a misdemeanor. But anyway, so 15 years later, Bernie is still saying that Barack's plan that he loved at the time, not doing so well. He quotes a figure of 85 million Americans not having health care insurance 15 years after we passed the public option, as Barack liked to call it. Well, what were we doing then? In 2010, 48.6 million Americans didn't have health care insurance. So we went from 48.6 million in 2010 when Obama signed it to now 85 million. And we're about to, if Donald Trump does not throw another $1.5 trillion at this problem, we're going to take it up from 85 million to 100 million Americans. It would seem pretty obvious that, we do have a broken healthcare system, and it has been exasperated by the Affordable Care Act, which I called in 2010 the Unaffordable Health Care Act. It is unsustainable. It is a broken system. The answer is not government. It's never been government. Ronald Reagan was dead on when he said all those years ago, the scariest words you'll ever hear. Hi, I'm from the government, and I'm here to help. They cannot fix the problem. The best thing that Donald Trump and the Republicans can do is not vote on that $1.5 trillion to make the problem worse and actually scrap the Affordable Care Act. If you're wondering what the actual replacement plan would be, make it private. Make it all private. Make it all private. Whenever government gets involved, costs rise dramatically. And you can see that right here. I mean, when we look at, he talked about Medicare Advantage. Barack said in his speech, Medicare Advantage is killing us. Well, how about this? Let me just read this to you. In 2010, 26% of the costs were going to Medicare Advantage. He was going to cut that through the Affordable Care Act. In 2025, 62% of the payments will be for Medicare Advantage. Did that cut the costs, or did it 3x it? I mean, how much more proof do you need that the government makes problems worse, not better? Barack said we don't want to have deficit spending. We don't want to have the Americans should not be paying extra for their health care costs. We are paying more than double what anybody's paying for it. And by the way, did it improve? No. Quality of life down. On top of it, life expectancy in the United States has dropped compared to other countries, similar countries. We're going the wrong way. And we're going the wrong way because we're trying to have our government fix the problem. The private sector is the only way to fix the problem. Get out of healthcare immediately.